Tonight we are presenting the candidates for the City of Alameda Healthcare District Board and the candidates for the 18th Assembly District. We'll hear from the Healthcare District candidates until 7:45. We'll take a very short break. Then we'll hear from the Assembly candidates. I do want to tell you that we have made an exception to our usual format this evening. Rob Bonta has a conflict due to a City Council meeting, and he has provided a proxy. It is always the League's intent to provide the best possible information to the voter, and we trust that this plan will best suit all of our interests. The two individuals before you are running for the position of board member for the City of Alameda Healthcare District Board. Each candidate will make an opening statement. Following this, we will present audience questions. Cards are being passed out on which you can write your questions, to which each candidate will give a 2-minute answer. Our question sorters reserve the right to combine similar questions and will choose a variety of topics. If we don't get to your question, we encourage you to speak directly with the candidates. The first question will be answered by the second speaker. This makes more sense when we have a lot of candidates. We only have 2. We will alternate is what we will do. Kate Quick will be our timer. She'll raise a green card when the speakers have a 1-minute warning, a yellow card, and a 15-second warning, and the stop sign to indicate that time has expired.
Would anyone else like cards? Questions?
The candidates here this evening are Tracy Jensen and Michael McCormick. Did I do that right? Mike McCormick. Thank you. I also have a statement from Jordan Batani. She could not be here this evening due to a work conflict, and I'll go ahead and read that one now. Thank you all for inviting me to participate in the candidate forum. The League of Women Voters plays such an important role by providing these community learning opportunities. I was looking forward to the opportunity to present my candidacy for re-election to the City of Alameda Healthcare District Board and to engage in dialogue and maybe a little debate with members of the community. Unfortunately, I had an obligation for work that was scheduled at the same time. I'm an advisor at a hospital and technology conference in Houston, and I was unable to find an itinerary that allowed me to be in both cities at the same time. One of the wonderful benefits of running for office this term has been participating in these community forums, answering questions, and talking to voters about their concerns. I'm really disappointed not to be there with you tonight in person. I've prepared a short newsletter that's available for you this evening on the table over here, where I tried to anticipate some of the questions that might be asked and to give you a little background about myself. I hope you'll take a few minutes to read it over. If you have more questions, there are a couple of local web-based news and commentary sites where I've provided written answers to a variety of questions from the community. If that doesn't work for you or you still have other concerns or questions, give me a call. She lists her home number, which I'll make available afterwards. I'm quite serious. We're all neighbors, and Alameda Hospital is our hospital. We should talk about it often. Thanks again, Jordan Batani. Okay, we will move on to our opening statements. If it's all right, we'll start with Tracy. 2 minutes.
Thank you, Dorothy. I'm laughing, and Mike is too, because we were at the Kiwanis yesterday, and they started with me again. I'm like, oh, don't start with me again tonight, but it's okay. Most of you who know me, I've worked with many of you on the League of Women Voters, and I can talk when I get a chance. So I'm going to not talk for 2 minutes, probably, or maybe I will. Kate, just be aware if you're watching. But I do want to say tonight, I want to just say 3 things. I want to start out by just saying 3 things. The reasons that I would be an effective board member and the reasons that I deserve your support. First of all, I know healthcare. I have a background of 20-year experience in healthcare. My degrees, I went to Emory University, even though I grew up in Alameda. I went far away to Atlanta to go to school to get a degree in public health, a master's in public health, because the Centers for Disease Control was there, and I wanted to go there to learn more about healthcare. That was my passion. I also, at the same time, got a degree in business administration because I knew I could be successful if I had an MBA, and it turned out that that worked fairly well. I worked for the federal government for 8 years in the Medicare program in Washington, D.C., and I did laws and regulations for Medicare and to govern the hospitals like Alameda Hospital that we're talking about. I know the Medicaid program. I've worked for the past 11 years in the city of Oakland with vulnerable seniors and low-income populations in Oakland who need healthcare and need services, and I've developed many partnerships with people to provide those services. I know how to be an effective board member. Many of you may recall that I was I led the development of the Lesson 9 for the Alameda School Board as a board member for 8 years. I led a number of effective proposals, including the Green Schools Initiative and the hired 2 superintendents. So I've been on board, I've been able to forge consensus, and that's really important. I know I have built partnerships as well as a board member. My time's up. Let me just close by saying, I know Alameda. I grew up here. I've lived here for most of my life, except for when I was in Washington. And I raised my son here, and I know what a great place it is to live, and I want to be on the board so that I can support Alameda, which I'm
Subtle. Anybody who knows me knows I'm subtle. Mike.
Thank you so much for inviting me. I appreciate it. For those of you who are sports fans coming up, I understand it's still 0-0, and I hope I don't lose your vote right off the bat because I'm a Tiger fan. So. Okay, with the nearest emergency room off island, 20 minutes away, community asset that is Alameda Hospital remains so and has been so since 1925. During my 4 years on the board, I have led efforts to stabilize the hospital through expanding outpatient services, and all 3 and possibly 4 of the things that we've accomplished, I think, are starting to turn the bottom line around. And you may have heard small hospitals have a very difficult time in existing these days. The first thing we did was to start a search for a skilled nursing facility, which we did, found it, and it's up and going. The next thing we did was create a wound center, which is up and going, with a hyperbaric chamber out in Marina. And recently we put together a couple of orthopedic surgeons for joint and spine injuries. We also had stroke certification. If you see a circle of life coming to light here, you can see what we're doing. We're pointing right at senior services. And the reason is that the growing population here in the island are seniors. And we're also reaching out to minorities, which is another great touch. But we're calling it the circle of life, and we're trying to fill this in. And hopefully, if I can have your vote, I'd appreciate it to have me have 4 more years on